So the new year is bringing a lot of changes to health care in this country. So we've brought in Sarah O'Leary of Exhale Health to talk about some of the things you need to know to save time and money. Sarah, thanks for being here.
Thanks for having me.
And I guess so many issues and subjects to hit on, but I think the first one will be in terms of the biggest health care mistakes that people tend to make. What are they?
The number one mistake that we make is we overpay. We don't read our bills clearly. We assume that not to question authority is what we should do, so we don't ask, well, why did the doctor send me a bill I don't owe? Or why does the hospital send me this bill? When really we have to look at things from an objective point of view. Do we owe it? How much do we owe it? And is the insurance company providing their part?
I guess one of the issues in that is that when you look at that bill, it's like, how do you read it? It just looks like gobbledygook to most of it. What do you suggest? What's your advice there?
When we have a medical event, it ends up that we receive a ton of different bills from the doctor, from the specialist, from the hospital, but we'll also receive an explanation of benefits from our insurance company. And that is our summary of benefits. It should be how we plan our true north. Look at that, compare it to the bills you receive, and look to see if you owe. We overpay $58 billion a year in bills we do not owe because we don't question them.
So what do you do if you see something and say, you know what, I know that's wrong, and you want to protest it, challenge it? What's the process?
The first thing you should do is call the healthcare provider who sent you that bill. A lot of times, even if you do in fact owe it, let's say it's against your deductible and you haven't met your deductible yet, you can call up and say, hey, is that the best price you can offer me? And oftentimes they'll lower it. So you'll save money just by making a phone call.
Wow, I never thought of that.
Nobody does, and that's, you know, and you can negotiate these before you even have an event or a procedure. If you have to go get LASIK, eye surgery, call around in your area and ask for a lower price, and you will get it.
Okay, and then you also advise that you make appointments with your doctors early in the year to get something set up. Why is that?
Well, what we have is what we call a benefits calendar. So most people, the calendar resets in our calendar year. So it will be, as of January 1st, starts a next run of 52 weeks against your deductible. You want to have all your tests and procedures done at the very beginning of that in case you need more help, so that in fact you can get covered.
Wow, incredible information. And for people who want more information from you and what you do, tell us how to find it.
They can write us at info@exhalehealth.com, and they can call our 800 number, which is 800-381-4741.
Very nice. Sarah, it's very nice to meet you.
Thank you.
Thanks for your insights. Still ahead here on